The district that had to choose. There was a district not too far from where you and I live. A place full of life, families, hope, but also a quiet crisis. Women were dying during childbirth, not because the solutions didn't exist, but because the right decisions had not yet been made. Meet Dr. Mensah, a newly appointed district health director. On his first day, a report lands on his desk. Maternal mortality is rising. He leans back and asks himself, what is the best way to solve this problem? And right there, without realizing it, Dr. Mensah has just entered the world of option appraisal. What is option appraisal? Option appraisal is not just a big academic term. It is simply a systematic process of comparing different interventions to choose the best one. Not the cheapest, not the easiest, but the one that is effective, efficient, feasible, and fair. The purpose. Why Dr. Mensah can't guess. Dr. Mensah knows he cannot rely on feelings. He needs to 1. Identify the best intervention. Not just any solution, but the one that actually solves maternal mortality. 2. Ensure maximum value for limited resources. Because his budget very small, every city must count. 3. Support evidence-based decision making. No politics, no assumptions. It's only data and facts. 4. Balance cost, effectiveness, and equity. A solution that works but only helps the rich? Not acceptable. 5. Promote transparency and accountability. If questioned, he must explain why this option. The 5 steps of option appraisal. Dr. Mensah doesn't jump into conclusion. He follows a structured path. 1. Step 1. Problem definition and objectives. He gathers his teams. They ask, what exactly is the problem? Not just maternal mortality is high, but maternal mortality is high in rural areas due to lack of skilled birth attendants. Now they set SMART objectives. SMART objectives, specific, reduce maternal deaths, measurable by 30%, achievable based on available resources, relevant, directly linked to maternal health, time-bound within 2 years. They also identify stakeholders, nurses, midwives, government, community leaders, mothers themselves. Step 2. Identification of options. Now the brainstorming begins. No idea is rejected yet. They list expand CHIPS compound, upgrade the district hospital, train and deploy more midwives, introduce mobile clinics, even do nothing. Yes, this is important as a baseline. Why include do nothing? So you can clearly see if any intervention actually makes a difference. Step 3. Data collection analysis. Now comes the serious work. Dr. Mensah asks for data, epidemiological data. How many women are dying? Where are the deaths happening? Clinical data, what interventions actually save lives? Economic data, how much does each option cost? Then they assess resource requirements, staff, equipment, funding, constraints, limited budget, poor routes, opportunities, NGOs support, existing chip structures. This stage makes the process evidence-based, not emotional. Step 4. Evaluation and comparison of options. Now the real decision making begins. They apply key techniques. Cost effectiveness analysis, CEA, cost per life saved. Cost benefit analysis, CBA, benefits versus cost in money terms. Cost utility analysis, CUA, outcomes using the QALYS or the DALYS. Then they compare options using criteria. Cost, is it affordable? Impact, would it reduce death? Feasibility, can we actually implement it? Equity, will rural women benefit? They rank the options and something becomes clear. Building a big hospital looks impressive but helps fewer rural women. Step 5. Decision and implementation. Dr. Mensah makes the call. Expand CHIPS compounds. Train more midwives. Why? The impact is high. Strong equity. Better coverage. More cost effective. Now they create an implementation plan. Assign rules. Set timelines. Begin monitoring and evaluation. Option appraisal is not about choosing what looks good. It is about choosing what works best based on evidence, cost, and fairness. In life, just like in health planning, you will always face choices, but the smartest people don't rush decisions. They define the problem, explore options, gather data, compare carefully, then act. That is option appraisal. This is Sir Eric reminding you. Good decisions are not guessed, they are appraised. Thank you.